We have all been there. That sharp, nagging sting every time you take the stairs, or that dull ache after a long walk. It is frustrating because you want to stay active for your longevity and general health, but your body is sending you a giant stop sign. Most people think the answer is just rest or popping a few pills, but that is actually the quickest way to turn a temporary issue into a permanent limitation. Today, I'm going to show you how to fix knee pain with simple exercise forever. We are moving past basic quad sets and boring leg lifts. I'm going to give you a complete, step-by-step knee reboot that addresses the hidden mechanical triggers most people miss. By the end of this video, you will understand why your knee is actually a victim of your hips and feet, and you will have a specific protocol to flip the pain switch to off. To understand why your knee hurts, we have to look at what I call the three-floor framework. Your body is like a three-story building. The knee is the middle floor, and it is almost never the source of the problem. If the foundation, your feet and ankles, is tilted or unstable, the middle floor has to twist to compensate. Most of us spend our lives in cushioned shoes that turn our feet lazy, causing the arch to collapse and forcing your knee to cave inward. We fix this right now with a movement called the foot fist. Standing barefoot, try to pull the ball of your foot toward your heel without curling your toes. You are essentially shortening your foot to create a rigid, powerful arch. This simple activation creates an immediate stable base that takes the torque off your knee joint. Here is the part everyone misses. Your knee is not just a hinge, it is designed to rotate. If your tibia or shin bone cannot rotate internally and externally, that force gets trapped inside the knee joint, grinding away at the meniscus. To fix this, sit in a chair and keep your heel on the floor. Without moving your thigh, try to rotate your toes inward and then outward. If your range of motion is limited, your knee is essentially locked in a way that causes inflammation. By performing 10 slow, controlled rotations on each side every morning, you are effectively greasing the hinges of that middle floor and teaching your nervous system that it is safe to move again. When you have chronic inflammation, your brain becomes hypersensitive. It perceives even safe movements as a threat. This is where most people make a mistake. They try to stretch the pain away, but you cannot stretch a structural instability into submission. Instead, we use isometrics. Think of isometrics as natural ibuprofen for your joints. By holding a muscle under tension without moving the joint, we create a physiological effect called tendon analgesia. We are essentially flooding the patellar tendon with blood and telling the nervous system to relax. The best way to do this is a simple wall sit. Place a small ball or a rolled-up towel between your knees and squeeze it as you hold the squat. This engages your adductors to help keep the kneecap tracking properly. Hold this for 45 seconds. You should feel a deep burn in the muscles, but often the sharp stabbing pain will significantly diminish afterward. Now we look at the roof of our building, the hips. If your hip is weak or lazy, your leg will collapse inward every time you take a step, putting massive pressure on the inner knee. Instead of lying on the floor doing clamshells, try the hip bump while standing. Stand on one leg next to a wall for balance, and let your hip drop out to the side. Now use the muscles on the outside of your hip, the glute medius, to pull your pelvis back to a level position. You should feel a powerful contraction right where your back pocket would be. This muscle is the vanguard that keeps your knee perfectly aligned over your toes in every step you take. The worst thing you can do for knee pain is to stop leg training. If the muscles wither away, the knee becomes even more vulnerable. We are going to reclaim the squat by squatting to a surface, like a chair or bench. This removes the fear of falling and allows your nervous system to relax. To perfect this, we use the drop squat. Hold the weight between your legs and let gravity guide it straight down to the floor. This weight acts as a counterbalance, forcing your torso into the ideal upright position and shifting the load from the kneecap to your powerful glutes.
This is a fundamental pattern for general health that ensures you can stay mobile for the next 50 years. Finally, the most important part isn't what exercise you do, but how you listen to your body. Use the 24-hour rule. When training, a little discomfort, around 3 out of 10, is normal. However, if the pain increases after 24 hours or doesn't return to its baseline, it means you did too much and need to reduce the intensity next time. On the other hand, if the pain subsides, you are on the right track. You aren't broken. Your body just needs time to recalibrate. This logical approach is the most effective way to manage your own recovery. Remember, your body was designed to move and adapt. No matter your age or what you've been told about your knees getting old, your tissues can get stronger if you give them the right stimulus. You now have the tools to rebuild your foundation and stabilize your hips. Don't forget to spend a few minutes each day on your knee checklist. Wake up your feet, use isometrics for pain, and focus on that laser pointer alignment over your toes. If you found this helpful, drop a comment with the word REBOOT so I can share more recovery tips with you. Your health is your greatest wealth. Let's keep building it together, one pain-free step at a time.